was one of our tele-recruiters calling up an existing donor to remind him of the blood donation from the computerized donor database to which she has already access. When the donor reaches Prathama Blood Center, he is given a donor registration form. He fills up the form and also gives his unique donor ID number so that the donation details are also updated in the software, completing his computerized records. This is the beginning of the entire automation process. The barcodes are a set of unique alphanumerical numbers which can be read by a barcode scanner without any error. This label goes on the primary bag. On the satellite bags, it also goes on the pilot tubes which would go for testing later. One of the tube would have clotted sample for ELISA testing, while the other tube would have anticoagulated sample for blood grouping. The label also falls on the donor form and the donor booklet once the donor is accepted. You can see the label being put on the donor form and the booklet, and this is how a filled up and accepted donor form looks like. After the medical history questionnaire, donor undergoes a brief physical examination which constitutes weight, blood pressure, pulse, body temperature and hemoglobin. After medical history and examination, donor comes to the phlebotomy area where the donor lies on a couch, the arm is prepared and the donor is bled. Blood weighing and collection monitor ensures that the blood is mixed with anticoagulant and the blood withdrawn is of the optimum quantity. After blood collection in the bag, segment is made from the tube which would be used for the cross-matching later. The donor details are entered into the computer and the barcode is scanned. This clip shows how the tubes go on robotic testing equipment. Each barcode is scanned. The sample is picked up by the robotic arm and dispensed in a microwell. The machine knows as to which sample has been dispensed in which microwell, and even the microplate has a unique barcode identity. The robotic machines perform the testing and blood grouping. This picture shows as to how the photograph taken of the blood grouping microplate would look like on the computer screen. The machine is also able to decipher the blood group from the pictures of agglutination in the microwell and that of the cells dispersed smoothly. The results of testing and grouping are then uploaded onto the software because of an interface between the robotic machine and the software. Another activity which happens in parallel is the component separation. We can see how the bags go inside a blood bag centrifuge, and the separation happens with the fundamental technology of utilizing differences in the specific gravity of various components. After the components are separated in the centrifuge, the component which is on the top is expressed into a satellite bag through an integral tube with the help of equipment called plasma expressor. Plasma expressor can be seen in the picture. Additive solution is then added to the red cells for longer shelf life, and after this the bags are detached as different components. The components which are separated get the component label like red cells, etc., go to quarantine, which is a separate area in the cold room. After the testing is through, the software generates composite label for the bag, which gathers all the information from the software like unique donation number, product name, blood group testing result, and even the date of expiry. If a bag is reactive for any infectious disease marker, only a biohazard label is generated, which can be seen in this picture. In the inventory module of the software, every unit of blood is allotted a slot in the cold room tray, which is barcoded, so that there is a computerized inventory of all units which are later issued on first in, first out principle. When the patient's relative come for blood component requisition, they come with a doctor's prescription or a filled up requisition form for the blood component and patient's sample. Here again a unique number is allocated to this sample and request. The patient's details are entered in the software. An appropriate unit is selected. The compatibility test is carried out with the donor's blood, and the results are again entered into the software. At the time of issue of unit, bag is scanned and the issue label is generated by the software and put on the bag. Along with this issue label, which can be seen in this picture, the issue report and invoice is also generated and printed, and they also go